Hi everyone, welcome to the Chiropractic YouTube channel. Today we're going to talk about everything you need to know about hip injuries. Now this is a pretty exhaustive topic, so if you are not really willing to watch a long video, this is not the one for you. We have other topics, other hip injury topics on the channel, so you can check those out if you aren't in for a long haul, but if you are, this is the video for you. So with hip injuries, of course, it usually comes from many different populations. We have athletic and sports hip injuries. We have, hip injuries in elderly folks, and we have stuff like hip dysplasia, which is congenital. I think today I'm gonna make this even more narrow and say that we're gonna focus on mostly hip injuries in sports. So today we're going to go over hip flexor strains, hip impingement, hip fractures, mostly stress fractures, labrum tears, and other hip issues that can, occur with sports. Hip dislocations are pretty uncommon, so I'm not going to get into that. So if you want to watch a hip dislocation video, look elsewhere. But otherwise, let's go ahead and start with the hip labral tear, which I feel like is probably one of the biggest fears in a lot of athletes out there. So the first thing that I want to say about a labral tear is, believe it or not, those can actually be asymptomatic for quite some time. And you can have a labrum tear on imaging, like MRI, without even knowing or having any symptoms. So that's the first thing to know. So that seeing it on MRI doesn't necessarily mean that it's the end of the world, because you can actually have it and not even know you have it. So let's back up a little bit and talk about what a labral tear actually is. So if you think about your hip, it's a ball and socket joint. So you have the socket, which is the acetabulum, which is part of the pelvis, and then you have your ball, which is the femoral head, the top of your thigh bone, basically, that goes into your pelvis here like this. So we'll use that ball and socket analogy quite a bit throughout this video. The labrum is a little cartilaginous ring around the acetabulum or the socket area. And it kind of helps the hip fit in and forms like a nice tight seal into that joint. It protects the joint from wearing and tearing, and it's there to kind of help with some minor bits of shock absorption. But it basically just kind of helps form like a nice fit and tight seal in between those two structures. Now, oftentimes the hallmark signs of hip labral tears are painful popping and clicking in the joint. A lot of people have popping and clicking in their hip joint, but not a lot of people have pain with popping and clicking. So it has to be painful popping and clicking for it to be, associated with a labral tear that needs to be fixed. Also, sometimes you'll have locking in that joint, like your hip will just lock on you and then you feel like you're gonna fall, or you can't really move through your regular range of motion, or something associated with that. You will also often have hip and or groin pain. Groin pain is really common in labral tears. A lot of times people will think it's like a tight adductor for a little while and then it won't go away, and then it gets worse and it starts to kind of go into like, the kind of hip area if it wasn't there first. It can also kind of, in guys, kind of refer into like more of the inner groin area, if you know what I mean. And that kind of concerns a lot of people. Sometimes people can confuse a labral tear with a sports hernia. Sometimes people have both, but a lot of times that like lower quarter of your like abdominal area can sometimes refer a labral tear, but it's most commonly the front of the hip, the groin, and then sometimes the back of the hip actually too. You can have a posterior or back of the hip labral tear, which is really uncommon, but it can happen too. So with the labral tear, you have that painful popping and clicking, you have possibly locking, you have pain in the hip or groin usually, or other associated areas that we mentioned. And then also, you'll have pain usually with internal rotation, squatting movements, and sometimes also external rotation too. So usually rotating And then hip flexion too will cause pain. So if you have hip flexion with external or internal rotation, that's usually more likely to be a labral tear. And it's usually something that can get pretty painful pretty quickly, although it is something that can kind of build steadily. The usual athletes that we suspect this in are running athletes, whether it's distance or sprinting. Soccer, basketball can happen. Sometimes powerlifting and weightlifting types of movements can have that too. And sometimes we do see this in swimmers, but it's not as common because you don't really have as much impact to that area. But usually those running type sports are labral tears. And sometimes people have like slight structural deformities in their hips that can cause a little bit more likelihood of having a labral tear. But you usually won't know that that's the case until you've already had one. So it's not something that you can usually prevent or know like, oh, I would have a larger likelihood of having a labral tear because I have this deformity. Usually you find out about that when you actually go in for the labral tear imaging. So the good news is that labral tears can be successfully rehabbed through. A lot of times people go in for the surgery and there's some really good outcomes with the surgery. But also there's potentially some not so good outcomes with the surgery. With people that I've seen or know that have gotten the surgery, I've had, probably as many people who have been happy with it as people who have been unhappy with it. And I've also seen professional athletes, recreational athletes, and college athletes rehab through a labrum tear and actually never have any pain. I have two examples that I'm thinking of. I have a professional soccer player and a professional runner who both were able to compete on a very high level, set personal bests, and play at a really high level while having a labral tear and just doing rehab exercise to fix that. So it's very possible, if you're willing to put in the work, that you won't have to go through the surgery and the surgery recovery time, because that can be a little extensive and it can knock you on your back for a while. And a lot of times that has a lot to do with hip strengthening, core strengthening, and teaching you certain ways to use your hips and core, and how to rotate through the hips in a safe way, especially if you're in soccer where you have to do a lot of rotating or lateral movements. So that's the labrum tear. We're going to move on to a associated topic, which is called a hip impingement. Sometimes you can have a hip impingement and a labral tear together. Yay. The good news is that the rehab for that is pretty similar. Usually hip impingements don't lead to surgical outcomes. Usually there's something that you can rehab through. There are some tests that we can do in the office to kind of tell you if you're, a rehab case or not. Usually that's one of the first things that we try to figure out with a hip impingement. And this will kind of have some similar feelings to a labral tear. And with the hip impingement, you won't have really as much of the popping and clicking, but you will have pain with flexion and internal rotation. Usually that's it. External rotation will sometimes hurt, but not always. It's usually the flexion and internal rotation that's the first cue. A hip impingement is when either the ball, the socket, or both can kind of get deformed in a way. It can happen with bony remodeling as you go through sports, or it can be something that you're born with. So usually either the socket kind of gets a little long and irritates the ball as we go through different movements. Sometimes the ball will get a little misshapen and kind of rub up against that socket area or the acetabulum. And then sometimes you have a little combination of both. And basically the hip impingement is just almost like, it's incorrect to call it a bone bruise, but if you want to think about it that way, it's a good analogy. It's kind of like an irritation or bruise into that hip joint. And basically what you need to do for rehab is to just sit the hip in a nice position where you kind of take those interfaces away from each other and allow it time to kind of heal. And usually you can go back to your activities. You just have to do a lot of working on how to use your body in a specific way that's not going to cause that constant friction. And that can often feel a lot like a groin strain or a hip flexor strain. Similarly to a hip impingement, you can get groin pain, you can get this front hip pain. It doesn't usually feel like a sports hernia, but it can, similar to a labral tear. and it's usually not as painful as a labral tear, and also does not have that locking sensation going on. It's something that can kind of get worse the longer you do certain activities, and it's something that generally tends to kind of go away and come back with certain movements, more so than a labral tear, which is usually a little bit more constant. So the other way to tell the difference between the two of them is obviously with imaging on an MRI, the labral tear will be present and it won't for a hip impingement. And then the hip impingement will show those bony changes. And yes, MRI is the only way to see a hip impingement. MRI is the only way to see a labral tear. That was my bad. The labral tear is only seen on MRI. You cannot pick that up on an X-ray, so that's not a good form of imaging, usually if you're worried about hip joint cartilage issues. And then we're going to move on to the stress fracture in the hip. So usually the stress fracture comes from athletic populations who are doing a lot of weight-bearing exercise, and usually it's like long-term weight-bearing exercise, so like long duration, so soccer, rarely basketball, but it could happen, distance running, stuff like that. Usually you don't find that in your swimmers. And the stress fracture it can feel really similar to all of those labral tear and hip impingement symptoms, but the main difference is that the stress fracture will hurt when you are resting too. The labrum tear can hurt when you're at rest. The hip impingement usually won't, but the stress fracture will hurt, and it will have like an achy feeling in the hip joint, and it will hurt all the time. It'll hurt when you're walking, it'll hurt when you're running, it'll hurt when you're laying down, when you're sitting. Anytime you're putting load on that bone, it'll hurt. And usually you can kind of point to it with one finger a little bit more than the hip impingement or hip labral tear, which will kind of travel around and can feel kind of like groin, can feel kind of like hip. But also, stress fractures are kind of tricky, and they can refer pain to places, and they can also kind of not follow that pattern of constantly hurting. Sometimes if they're in their earlier stages, they'll hurt only with running. Sometimes they'll almost feel like they're getting better or like you're warming up into it, and then it'll hurt terribly afterwards. So with the stress fracture, the way that we tell in the clinic is that basically all the hip tests hurt the person, because anytime you kind of load directly into that bone, it's going to hurt. So the labrum tear tests are going to be positive, the hip impingement tests are going to be positive, but also a lot of other joint movements that would not bother a labrum tear or a hip impingement would bother a stress fracture. That can be seen sometimes on X-ray, but is better viewed on MRI, because if it's a early stage, it probably won't be caught by X-ray. X-ray is not the best way to find a stress fracture. MRI is. And then that one's usually treated with rest, but also you have to figure out why you got the hip, the stress fracture in the hip, because the femur is usually a really strong joint, so you want to look into dietary factors, you want to look into your loading patterns, and see if there's a specific reason why you're using this hip so much. Sometimes people will come back from an injury on the other side and will be compensating a lot on one side, on the other side, and will end up getting a stress fracture on that side because they never got themselves rehabbed and comfortable enough using the prior injured side. So for instance, you had a knee injury on your right side, and so knee injury on the right side, you came back from that, but you were still continuing to load the left side every time you ran. And so the left side had to take a lot more weight and impact than it was used to or should have been. And you ended up with a stress fracture on that side because you weren't comfortable using the right. So the rehab for that would, along with just resting the bone, you want to make sure that that right side's good and working. And you can usually see that on movement analysis. However, when the stress fracture is pretty acute, it's hard to see because you're not going to be moving normally if you're in pain. So that's something that's better looked at when the stress fracture has the pain has kind of calmed down a little bit. There's a lot that we could get into with stress fractures, but that's just the brief overview for this video. I will post some more things on stress fractures at some point. It's kind of a it's one of my favorite topics actually, because I work with a lot of runners, and it's something that I nerd out on a lot, so we'll talk more about that at some point. And then the final topic that we wanted to talk about is a hip flexor strain or hip muscle injury. Usually the hip flexor strain will hurt whenever you use the hip, so that means if you're going from standing to picking up the hip, it'll hurt all the way from the bottom to the top. it'll hurt anytime you use it, such as running, walking, lifting. All of those things should hurt if it's going to be a hip flexor issue. It should feel uncomfortable for all of those. And then if you're resting it, it shouldn't bother you generally. Sometimes if it's really acute or if you've torn it, then it will hurt when you're at rest. The way to tell that if it's torn is that usually there's some bruising, swelling in that area, some discoloration, and it was something where you just felt it and it never went away after that. So like you were sprinting and all of a sudden you felt it there and it just was constant after that. Also, if you touch the muscle, it should hurt really bad. If you're touching the muscle and it doesn't hurt, then it's probably a hip joint issue. That rehab's a little different, so we'll go ahead and give you some videos on the rehab for all of these injuries independently, but that is a brief overview of all the most common sports hip injuries. There's some other weird ones that are really uncommon, like bursitis. People think it's really common, but if there's no swelling in the area, it's probably not hip bursitis, because the bursa has a little fluid-filled sac and it has to kind of swell up to be bursitis, because that literally means inflammation of the bursa. And so if there's no swelling, it's not a bursitis. There is a few other hip conditions that are not as much common to athletic populations. That will be a separate video. So go ahead and let me know if you have any questions about your hip injuries, and if there's any other topics on hip injuries that you want me to make a video for, just go ahead and leave me a comment below or subscribe. Thank you so much. Have a great day.